to that end, I'd like to introduce Olga Varetska. Olga has been working for the International HIV-AIDS Alliance in Ukraine for over 9 years. Her experience includes development of programmatic monitoring and evaluation systems, building national and regional monitoring and evaluation systems, coordinating surveys and surveillance among risk groups, and managing data triangulation exercises, and so on. So, thank you, Olga.
Thank you very much. Good afternoon, ladies and gentlemen. Today I would like to talk about the HIV prevention program among people who inject drugs in Ukraine and how it impacts the HIV epidemic in my country. A little bit of background. The total estimated number of people living with HIV is 238,000, or 0.9% of the adult population in Ukraine. The estimated number of people who inject drugs is 310,000. The main injectable drug that is used is a homemade opioid. Also, homemade methamphetamine-type drugs are prevalent. The HIV epidemic started in 1995 among people who inject drugs in southern and eastern regions, and the mean HIV prevalence among people who inject drugs today is about 18%. Here you can see the HIV prevalence trend across the past years, and also the map of Ukraine that indicates the regions that are most affected by the HIV epidemic among drug users. A broad nationwide HIV prevention program among injecting drug users is implemented in Ukraine. This map shows the regions of the Ukraine covered according to the HIV incidence rate in the country, as well as the prevention programs among the key populations that are currently active in all regions of the country. The red dots indicate the presence of HIV prevention programs among people who inject drugs. The graph below indicates the trend of the coverage rates of people who inject drugs with HIV prevention programs. The minimum package of HIV prevention services provided to drug users includes syringes, condoms, information materials, consultation, and access to HIV testing. At the right, you can see the age distribution of program clients, people who inject drugs, and the gender distribution among them. This slide briefly describes the services and consumables received by people who inject drugs in programs. As you can see, on average, every person who injects drugs receives 100 syringes per year, 41 condoms, sachets of lube, and access to TB testing, testing for HIV, testing for STIs, hepatitis C and B, and some clients also receive OST services. This is the distribution of syringes by type of venue, and as you can see, street outreach is the most common means of providing syringes to people who inject drugs. Okay, so after this brief background, I would like to go directly into the results of the HIV rates, the results of programs that are depicted in HIV rates going down among people who inject drugs. This slide depicts the risky behavioral patterns among people who inject drugs over the past years. And as you can see, despite of the fact that such risky practices as using a preloaded syringe and chaining a container still being high, the rate of needle and syringe sharing is considerably low and has decreased considerably during the past years, from about 25% to about 8% in the past year. So looking at the HIV incidence, and there are two proxy measures for HIV incidence that we were looking at. We can also see impact of the HIV prevention programs among people who inject drugs. So this slide depicts the official case registration data. And as you can see, starting from 2010, the number of newly registered HIV cases among people who inject drugs have been steadily decreasing. And if you look at the subgroup of young people who inject drugs below 25 years of age, this trend is even more pronounced. Another proxy used for HIV incidence, which is based on IBBS data, is HIV prevalence among young and recent people who inject drugs. So looking at these subgroups of the whole PWID population, we are trying to approximate, to come close to the incidence data. And as you can see, both trends among both of these two subgroups of PWID indicate a decrease of HIV incidence across the past years. At the same time, there are also worrying trends of growing heterosexual means of HIV transmission in Ukraine. This slide shows the key modes of HIV transmission. And as you can see, the red line, which demonstrates the heterosexual HIV transmission, indicates that more than half of all newly registered HIV cases during the past year were attributed to heterosexual means of transmission. And basically, as a result of this, despite of the decrease in HIV registration among people who inject drugs, as we can see in the blue bars, the red bars, which are the overall number of newly registered HIV cases among all groups, among general population in Ukraine, we do not see the same trend in general population yet. What we can see, we can call a plateau, but it's not a considerable decrease for sure. We are also looking at the spectrum modeling results in order to see if there is a similar trend in changes of the modes of transmission. And indeed, if we project the HIV incidence among different groups of population for the coming up years, we see that the heterosexual transmission is increasing drastically compared to other sections. So, for example, the IDU, the injecting drug use means of HIV infection is decreasing, as you can see the dark blue part of the slide, while the light blue, which is called spectrum called remaining populations, this section is increasing. And we know it is heterosexual transmission because MSM are separate on the slides, and basically that's what is left. So the good question is, so who represents this remaining population? What group of people are there in this light blue part of the diagram? To answer this question, and basically a number of other related questions, a separate data triangulation study was carried out in Ukraine, and it looked at it basically looked at the whole country and divided it into three terciles of regions based on the incidence among people who inject drugs. So we had the group of regions that had the highest incidence among PWID, and the medium one and the lowest one. And what you see on these two graphs, the first graph shows the reported HIV cases in people who inject drugs by people PWID incidence tertile across the last years. And on the right, on the graph on the right, in the same tertiles based on the HIV case registration among PWID, we see the HIV cases in young women who were heterosexually infected. And basically, if you look attentively at the two graphs, we can see that there are similar trends evident among young women infected heterosexually as among PWID in the regions most affected by the PWID epidemic. And basically, this similarity suggests that heterosexual transmission is linked to the existing HIV cases among people who inject drugs. That is, it is happening among sexual partners of people who inject drugs. So what does behavioral data say? Does it confirm this hypothesis? Basically, as we can see, the condom use during the last sexual intercourse among people who inject drugs is still quite low. Almost in 50% of cases, PWID do not use condoms. And basically, this confirms the risky sexual practices and the probability of virus spread from PWID to their sexual partners. To conclude, basically there are three main conclusions. The first one being that there definitely is an inverse correlation between the coverage of prevention programs and the number of new HIV cases among people who inject drugs in Ukraine, as the graph to the right suggests. At the same time, we should not forget that decreasing coverage of PWID or limiting the service package provided to people who inject drugs, which would be inevitable in case of the anticipated decline in funding of services for people who inject drugs in Ukraine, would undermine this success that was already achieved. And the last point is that there is definitely a need to focus on the sexual mode of HIV transmission among people who inject drugs and their partners in order to achieve significant results in suppressing HIV rates among the general population. Thank you very much for your attention.
Thank you, Olga.